Who taught you that procedure? Answer me, who was it?
Ariana Nelson said nothing for 3 seconds. Then she leaned toward Chief of Surgery, DeWitt Hollister, and whispered, Task Force 160. Nobody else in the trauma bay heard it. Nobody else would have understood it if they had. What they did see was a 28-year-old nurse, the one Dr. Grayson Langdon had spent 3 months dismissing as a floor nurse, with no business touching a surgeon's decisions, standing over a man whose heart had flatlined 60 seconds earlier. Every imaging screen in the room was still dark. The REBOA catheter she had placed blind was sitting in perfect position inside his aorta. She had just done the impossible, and by morning, they were going to try to take everything from her for it. If you're new here, this channel tells the stories of ordinary people who turn out to be anything but. Hit subscribe and stay with us. You're going to want to hear how this ends. Nobody at Harborview Medical Center had figured out what to make of Ariana Nelson. She had been working trauma for 94 days, long enough to know every supply cabinet on the floor, short enough that the senior residents still treated her like a temp. Her paperwork was clean, her references checked out, and her nursing credentials were exactly what she said they were. There was nothing on her record that would have made anyone look twice. That was most likely the point. She was quiet in the way that some people are quiet because they have nothing to say, and others are quiet because they have learned at some cost to say nothing. The staff who worked alongside her could not have told you which category she fell into. She did not complain, did not gossip, and did not push back when she was handed the worst assignments on the overnight rotation. She showed up, she worked, and when the shift ended, she walked to her car alone. What the staff noticed, the ones who paid attention, were smaller things. The way Ariana's eyes moved when she walked into a room for the first time. Dollar equipment layout position of every person present in that order every single time. The way she could look at a patient coming off a gurney and already be reaching for the correct supply before the paramedics finished their handoff report. The way her hands stayed completely still in situations that made other nurses step back from the bed. These were not things that nursing school produced in a person. Most of the staff filed them under instinct and moved on. Dr. Grayson Langdon had a different explanation. Langdon was the chief surgical resident, 33 years old, second in line behind Hollister, and convinced that this position made him the most important person in any room he entered. He had decided early that Ariana was the kind of nurse who compensated for a lack of real skill by moving fast and looking confident. The stillness that others found unsettling Langdon read as blankness. The economy of her movements he called mechanical. He had told 2 of the other residents over coffee that she was a floor nurse in a trauma setting, and that she would eventually do something that got someone hurt, and he intended to be the one to document it when she did. Ariana was aware of this. She was aware of most things Langdon said about her because she had learned a long time ago to track the people in a room who considered themselves a threat. She did not particularly mind. She had been underestimated by people in circumstances considerably more dangerous than a hospital corridor. And the experience had taught her that being underestimated was on balance more useful than being feared. The call came in at 11:47 on a Tuesday night in November. The rain had been hitting Seattle hard for 3 days, the kind of slow, relentless Pacific Northwest rain that soaked through everything and made the highways outside the city slick and unreliable. The paramedics who radioed ahead sounded like men who had seen bad things before and were still not comfortable with what they were looking at. The patient was a factory worker from the Boeing Everett plant, 32 years old. A 12-ton assembly fixture had failed its mounting and come down across the lower half of his body. He had been pinned at the hip for more than 40 minutes before the rescue crew could lift it free. His name was Marcus Webb, and by the time the ambulance doors opened at the Harborview Bay, he had already used most of the time he had left. Ariana was on the trauma bay floor when they brought him in. She helped transfer him to the table and got her first look at the full picture in about 4 seconds. Abdomen rigid and distended pelvis, visibly asymmetric skin color wrong. The kind of pallor that came not from fear, but from a body that was running out of something it could not replace. The monitor went on and gave them numbers that did not leave much room for debate. Blood pressure, 52/30, heart rate 145, and climbing oxygen saturation still dropping. Langdon was already talking before the gurney stopped moving. He called for a massive transfusion protocol, ordered the pelvic binder applied immediately, and began directing the team with the practiced authority of a man who had run these scenarios many times in training and was confident the training applied here. The nurses moved. The blood was requested. The binder went on. Ariana had already triggered the transfusion protocol before Langdon finished his sentence. Her hands were moving on autopilot, while her eyes stayed on the patient's abdomen, and what she was seeing did not match the plan Langdon was building. The rigidity was too pronounced and too high. The distension pattern was wrong for a simple pelvic bleed contained by a binder. She had seen this configuration before, and she knew what it meant, and she knew that the massive transfusion Langdon had just ordered was going to accelerate the problem rather than solve it. She said it once clearly. The source of the hemorrhage was proximal, either the descending aorta or the iliac bifurcation. The blood being pushed into Marcus Webb's veins through the transfusion lines was not staying in circulation. It was going directly into his abdominal cavity. The binder would slow the mechanical instability of the pelvis, but it would not touch the arterial source. At the current rate of loss, he had less than 3 minutes before cardiac output became incompatible with survival. Langdon looked at her the way he always looked at her when she spoke during his trauma activations. He told her that he had not asked for her assessment, and that if she was concerned about the transfusion rate, she could keep her concerns to herself and focus on the IV lines she had been assigned to manage. He used the words "floor nurse" in a way that was not quite an insult and was not quite not one. Ariana did not argue. She turned back to the patient and kept working because arguing was not going to save Marcus Webb, and the clock she was running in her head was now past 2 minutes. DeWitt Hollister was 4 floors up when the page came through. He moved fast for a man his age, but the elevator was slow and the stairwell was on the wrong side of the building, and by the time he reached the trauma bay doors, the monitor inside had already gone flat. She heard it go flat before she saw it. The rhythm had been deteriorating for the last 90 seconds. She had watched it on the screen above the bed, while her hands kept doing what they were supposed to do, and when the waveform finally smoothed out into a single unbroken line, her body had already made the decision her mind was still formally considering. Langdon called for CPR and began chest compressions. Ariana reached past the nurse beside her and opened the lower cabinet beneath the trauma bay counter, the one that held equipment that almost never got used in a civilian emergency department. The REBOA kit was exactly where she had noted it on her 3rd day of work. Resuscitative endovascular balloon occlusion of the aorta. A catheter threaded through the femoral artery advanced into the aorta, a balloon inflated to temporarily occlude blood flow to the hemorrhage site. It was not a complicated concept. The execution was something else entirely. In standard practice, the procedure required ultrasound guidance to locate the femoral artery, fluoroscopic imaging to confirm catheter position inside the aorta, and a surgical team standing by to manage the consequences of anything that went wrong. The margin for error was measured in millimeters. If the balloon was placed too low, it would do nothing. If it was placed too high against the heart wall, it would end the patient's life in a different and faster way. Ariana had none of the required equipment. The ultrasound machine was across the room and powered down. The fluoroscopy screen was dark. There was no surgical team. There was a flatlined patient, a panicking resident doing CPR that was pumping blood faster into a cavity where it could not circulate, and a clock that had already run out. She said Langdon's name once loud enough to cut through the noise and told him to stop compressions and move away from the table. Langdon did not stop. She told him again with enough of something in her voice that 2 other nurses in the room went still. Langdon told her she was out of her mind, grabbed for the kit in her hands, and when he lunged across the table, the edge of his foot caught the instrument tray on the floor beside him. Metal hit tile. Langdon went sideways. Rebecca Hart, a night shift nurse who had been watching the last 30 seconds with her hands pressed flat against the supply counter, stepped between Langdon and Ariana and put her body there and kept it there. Ariana was already at the bed. There was no femoral pulse to guide her. The heart had stopped producing one. She placed 2 fingers at the anatomical landmark. She was looking for the point where the femoral artery ran beneath the inguinal ligament, a location she could have found in the dark by feel alone, because she had found it in the dark by feel alone in conditions that made this trauma bay look like a classroom. The needle went in on the first pass. She threaded the wire, measured the catheter length against the external markers of Marcus Webb's body. The distance from the insertion point to his xiphoid process, and advanced the balloon to zone 1 of the aorta above the celiac axis below the diaphragm. If she was off by 2 centimeters in either direction, the next sound in the room would not be a monitor alarm. She inflated the balloon. The flow of blood to the devastated pelvis below was occluded. The transfused blood already in his system, the blood Langdon had correctly ordered, and that was now doing what it was designed to do, had nowhere to go but up into the coronary arteries and the carotid vessels and the chambers of a heart that had been empty for 40 seconds. The first electrical complex appeared on the monitor. Small, irregular. The kind of thing that could disappear as quickly as it came. Then a second one, stronger. Then a third. Marcus Webb's heart came back. The blood pressure reading took another 8 seconds to register 110/70. Imperfect, adequate, alive. Nobody spoke for a moment. Not Langdon, who had pulled himself upright from the floor and was standing at the edge of the room with an expression that had not yet resolved into anything nameable. Not the other nurses who had stopped moving when the monitor changed and had not yet remembered how to start again. Not Rebecca, who was still standing exactly where she had planted herself, and whose eyes had not left Ariana's hands since the needle went in. The doors to the trauma bay opened. DeWitt Hollister walked in, read the room in the time it took him to cross the threshold, and stopped at the foot of the bed. He looked at the catheter. He looked at the screens, the imaging screens that were still dark, every one of them. He looked at the blood pressure reading. He looked at Ariana, who was standing with both hands on the catheter line, her posture as level and unremarkable as if she were monitoring a routine drip. Hollister had been practicing trauma surgery for 25 years. He had trained at Johns Hopkins, done 2 fellowship years in Houston, and spent a combined 14 months attached to combat surgical teams in Fallujah and Kandahar. He knew 3 physicians in the Pacific Northwest who would have attempted a blind REBOA placement in a civilian emergency department, and he would not have expected any of them to pull it off without imaging. I was looking at a nurse who had just done it on the first attempt on a patient with no detectable pulse and whose hands showed no tremor whatsoever. This was not a lucky guess. Whatever Ariana Nelson was, she was not what her personnel file said she was. Langdon said something about unauthorized procedures. Hollister did not look at him. He kept his eyes on Ariana and asked her quietly who had taught her that procedure. She did not answer right away. The room waited. and then she leaned toward him just close enough that only he would hear, and said the three words that changed everything. Task Force 160. Hollister heard the words and did not move. Around him, the trauma bay was still processing what had just happened. Nurses checking lines. Someone writing the overturned instrument tray, the monitor above Marcus Webb's head, printing out a rhythm that had no business existing given what the last 4 minutes had looked like. None of them caught what Ariana had said. None of them would have known what to do with it if they had. Hollister knew exactly what to do with it. He had spent 14 months in theater spread across 2 deployments, embedded with surgical teams that operated out of forward operating bases in places where the nearest Level 1 trauma center was a helicopter ride and a prayer away. He had heard the designation before, not often, and never in a context that invited follow-up questions. The 160th Special Operations Aviation Regiment. Night Stalkers. The unit that flew the missions nobody talked about into the places nobody acknowledged for the people whose names did not appear in press releases. The fact that Ariana Nelson had just invoked that name in a civilian trauma bay in Seattle, Washington, told him several things simultaneously, and he needed a moment to arrange them into something he could act on. Langdon was already talking. He had recovered his footing and his voice at roughly the same time and was now directing his words at the security officer who had appeared in the doorway, pointing at Ariana using phrases like unauthorized procedure and immediate detainment, with the confidence of a man who believed that the louder and faster he spoke, the less anyone would think about what had actually happened in this room 3 minutes ago. Hollister turned toward him with the particular stillness of someone who has learned that stillness applied correctly reads as a threat. He told Langdon to stop talking. He said it once at a volume that was not loud, and Langdon stopped. Hollister looked at the monitor. He looked at the catheter line running from Ariana's hands into the patient's groin. He looked at Ariana's face, which had not changed expression since he walked in, and he made the decision that his 25 years of experience and everything he understood about what he was looking at told him to make. He told the room that the patient needed the operating room, that he needed it now, and that Ariana would be moving with the gurney and maintaining catheter position throughout transport. Then he looked at Langdon and told him that if he said one more word before they were inside OR4, he would be making a phone call to the chief of staff before sunrise. The transport team moved. Rebecca helped guide the gurney. Ariana walked alongside with both ends steady on the catheter line, not looking at Langdon, not looking at anything except the 12 inches of tubing that stood between Marcus Webb and the same flatline she had pulled him back from once already. The clock in her head had restarted the moment the balloon inflated. 45 minutes before the occluded tissue below began to die. They had used at least 8 of those minutes already. Hollister fell into step beside her in the corridor, far enough from the transport team to keep his voice between the two of them. He asked her to explain Task Force 160. Not the name, he understood the name. He wanted to know what her role had been, because what he had watched her do in that trauma bay was not a skill that came from nursing school or from reading procedural literature, and he needed to understand the gap between what her personnel file said and what his own eyes had just shown him. Ariana kept her gaze on the patient. She told Hollister that most of what he wanted to know was still classified, and that the parts that were not classified were not something she was going to discuss in a hospital corridor at midnight. She said it without apology and without aggression, in the tone of someone stating a policy that was not negotiable. Hollister considered her profile for a moment, the set of her jaw, the complete absence of anything that looked like performance anxiety, and decided that pressing further right now would cost him time he did not have. He told her she could keep her answers for later. Then he pushed the OR doors open and held them for the gurney. What they found when the abdomen was opened was worse than the imaging would have shown if anyone had run imaging. The pelvis had not merely fractured, it had collapsed inward along 3 separate axes, and the force of the compression had torn the iliac vessels on both sides in a pattern that looked less like a traumatic injury and more like deliberate destruction. Blood clot filled the retroperitoneal space in a volume that made Hollister's jaw tighten. The REBOA balloon had done what Ariana designed it to do. It had held the proximal pressure and kept enough circulation in the upper body to preserve cardiac function. But below the balloon, the venous network was still bleeding in the diffuse low-pressure way that was harder to chase and just as lethal given enough time. The patient's core temperature had dropped to 34 degrees Celsius. Hollister called for active warming and watched the coagulation numbers on the display with the attention of a man who has seen the death, triad hypothermia, acidosis, coagulopathy, assemble itself in real time and knows exactly how quickly it closes the window. He kept his hands moving and kept his mind on the sequence of what needed to happen next. Ariana was at the head of the table monitoring the balloon pressure and the transfusion lines simultaneously. She told Hollister without being asked that the coagulation cascade was breaking down and that tranexamic acid and calcium chloride needed to go in before the clotting factors fell any further. Hollister agreed immediately and called the order. He had come to a working conclusion somewhere between the trauma bay and this operating table. Whatever Ariana Nelson's background was, she was not guessing. She was reading the patient the way someone reads a patient when they have seen this particular configuration of injuries before, in circumstances where getting the read wrong had consequences that went beyond a malpractice filing. Langdon was still in the room. He had followed the transport under the apparent belief that his presence as chief resident gave him standing to be there. And up until this point, Hollister had been too focused on the patient to address it. That changed when Langdon stepped to the left side of the table, picked up a vascular clamp, and moved toward the deep pelvic field with the body language of a man trying to reassert something he felt had been taken from him. Ariana's voice came from the head of the table, clear, specific, not loud. She told Langdon that the structure he was approaching was not the arterial bleeder. The actual source was approximately 2 centimeters deeper and 3 centimeters lateral, running behind the remaining pelvic sidewall. She said it the way you tell someone where the light switch is in an unfamiliar room, a statement of fact useful, take it or leave it. Hollister reached across and stopped Langdon's hand before the clamp closed. He looked at the field. He repositioned, found the vessel Ariana had described, and confirmed that if Langdon had clamped where he intended, he would have caught the right ureter. The kidney function on that side would have been compromised before anyone in the room realized the error. Langdon did not speak. He put the clamp down. Hollister did not look at him when he said in a voice that carried the flat finality of a decision already made that Langdon was done at this table. He told him to scrub out and wait outside, and that they would discuss the rest of this in the morning. Langdon stood still for one more second, the kind of stillness that was not calm, and then he walked to the scrub sink and did not come back. Hollister looked across the table at Ariana. He did not make a speech about it. He extended one gloved hand palm up and waited. She snapped a second pair of sterile gloves over her existing pair, moved to the operative field, and reached into the pelvic space with the unhurried precision of someone who knows what they are looking for and exactly where to find it. The arterial vessel had retracted deep into the surrounding tissue, a common response to catastrophic injury, the body's attempt to limit its own blood loss. She found it by 2 fingers tracing the anatomy beneath the field until the faint mechanical pulse registered against her fingertips, and she held it in position while Hollister set the clamp. The bleeding stopped. Not slowed, stopped. What followed was the kind of surgery that does not make for dramatic television because the drama is entirely internal. It lives in the decisions made in 2-second windows, in the constant recalculation of what the patient can tolerate versus what the injury demands, in the communication shown between two people who have never operated together and yet are somehow operating in a shared rhythm that neither of them has to explain. Ariana managed the balloon deflation in gradual increments, checking each reconstructed vessel segment for integrity before releasing the next unit of pressure. She tracked the transfusion volumes and called the labs before Hollister thought to ask for them. She handed him instruments he had not yet reached for because she had already determined what the next step required. When the final suture went in, Marcus Webb's vitals had stabilized into a range that was not comfortable but was sustainable. Hollister stripped his gloves and looked at the clock on the OR wall. They had been in the room for just over 4 hours. He told the circulating nurse to arrange ICU transport and said to no one in particular that the patient had a reasonable chance of walking out of this hospital. Then he looked at Ariana and said that she had saved that man's life. She was pulling her outer gloves off, rolling them inside out, the way people do when they have done it 10,000 times, and she looked up briefly when he spoke. She told him she was doing her job. She said it without deflection and without modesty. She said it as a statement of plain fact, which Hollister reflected as he walked toward the scrub sink, was probably the most precise thing anyone had said in this hospital all night. She did not sleep. There was no point. She went to the staff locker room and changed out of her scrubs and sat on the wooden bench between the rows of gray lockers and listened to the building settle into its 4 a.m. rhythms. The distant machinery of the HVAC system, the occasional footstep in the corridor above the elevator, arriving at the wrong floor and leaving again. She was not afraid, exactly. She had learned a long time ago to distinguish between fear and the recognition of incoming difficulty, and what she was feeling was the latter. She could see the shape of what was coming as clearly as she had seen the shape of Marcus Webb's arterial anatomy in a dark operative field, and the shape of it was not good. They called her into the executive conference room at 8:15 the next morning. Richard Caldwell, the hospital CEO, was already seated at the head of the table when she arrived. Langdon was standing near the window with his arms at his sides and his expression arranged into something that was performing neutrality but was doing it poorly. A printed document sat on the table in front of the empty chair across from Caldwell, and it was thick enough that Ariana understood before she sat down that this meeting had been in preparation for several hours. Caldwell laid out the case against her methodically. Invasive procedure without physician licensure. Operation outside registered nursing scope. Insubordination during an active trauma activation. Institutional liability exposure that his legal team was still calculating but had already described as significant. He spoke in the measured cadence of a man who had delivered this kind of news before and had learned to deliver it without emotion, because emotion created openings for argument. He told her that her employment at Harborview was terminated effective immediately, that the hospital would be filing a complaint with the Washington State Nursing Commission, and that the outcome of that filing would likely determine whether she ever held a nursing license again. Langdon's version of the previous night came next. He described himself as the physician in charge of an orderly resuscitation who had been violently disrupted by an unstable subordinate. He used the word volatile. He used the phrase escalating behavior pattern. He referenced the instrument tray, the one he had knocked over when he lunged for the REBOA kit, and caught his own foot on the edge as evidence of a physical altercation that Ariana had initiated. Ariana sat with her hands flat on the table and said nothing. She understood the architecture of what was being built around her, and she understood that she could not take it apart without disclosing things she had not planned to disclose to people who had not yet demonstrated that they deserved to know them. A nurse nobody had heard of claiming a classified military background that could not be verified before the paperwork in front of Caldwell was signed, that was not a defense. That was a story, and stories without evidence did not survive bureaucratic machinery of this particular kind. Caldwell slid the resignation document across the table toward her. He told her that signing it was in her best interest, that it would allow the hospital to close the matter without a formal disciplinary record that would follow her indefinitely. His tone implied that he was doing her a kindness. She looked at the document, and she looked at the pen beside it, and she did not pick up either one. She was still deciding when the conference room door opened. DeWitt Hollister did not knock. He came through the conference room door the way he moved through every space he entered, with the unhurried certainty of a man who had long ago stopped waiting for permission to go where the situation required him to be. He was not wearing his white coat. He had on a dark jacket over his scrub top, and he was carrying a single sheet of paper that he did not set down on the table. Caldwell looked up with the expression of someone whose carefully managed process had just been interrupted. He asked Hollister what he thought he was doing. Hollister pulled out the chair beside Ariana and sat down, and when he answered, his voice had the quality of someone making an observation rather than an argument patient, even completely without heat. He said that nobody in this room was going to fire Ariana Nelson, and that he thought it was worth discussing why before anyone signed anything. Caldwell said that the matter had already been reviewed and that the legal exposure was clear. He said that Hollister's opinion of the clinical outcome did not change the institutional facts, and that Ariana had operated outside the legal scope of her license, regardless of what the result looked like. He spoke precisely, which was how Caldwell always spoke when he was trying to close a conversation before it became a negotiation. Hollister let him finish. Then he placed the piece of paper on the table and said that what Caldwell was calling a liability was in his professional assessment, the only reason Marcus Webb was not in the morgue. He said that what Langdon was describing as an orderly resuscitation was based on his own observation of the room when he arrived, a flatlined patient and a resident who had run out of options. He told Caldwell that if this hospital wanted to bring the events of last night into any kind of formal or legal proceeding, everything that happened in that trauma bay would need to be part of the record. Everything. Langdon made a sound that was not quite a word. Hollister looked at him briefly, the way you look at something that has moved in your peripheral vision, and then returned his attention to Caldwell. He said that he had made a phone call the previous night, a contact he had maintained since his deployment years, a senior officer currently attached to a special operations command that he would not be naming in this room. The call had taken 12 minutes. What came back was not a file, not documentation, not anything that Caldwell could read and stamp and file away. What came back was a confirmation the name Ariana Nelson was known to people whose operational security was tight enough that the confirmation itself had been given carefully in language designed to deny plausibility if repeated. It was not the kind of evidence that won administrative hearings. It was the kind of evidence that told Hollister everything he needed to know about whether the woman sitting beside him was who she appeared to be. Caldwell looked at the piece of paper, a single printed sheet with a few lines of text that were not enough by themselves to end an argument. He said that a phone call was not documentation. He said that without verifiable credentials or official records, the hospital's position remained unchanged. He folded his hands on the table and looked at Ariana, and his look said that the pen was still available if she wanted to reconsider the offer that had been made before the interruption. Everyone in the room looked at Ariana. She had made her decision somewhere between the moment Hollister sat down and the moment Caldwell said the word documentation. She could see the weight of what was being asked, and she could see that Hollister had walked into this room armed with the best he could get in 8 hours, and that it was not enough. The machinery was going to keep moving unless someone stopped it, and the only person in this room who could stop it was the one person who had spent 3 years making sure nobody knew enough about her to ask the right questions. She did not pick up the pen. She put both hands flat on the table, the same hands that had held a femoral artery in a destroyed pelvic field at 4 in the morning, and she began to talk. She said that the personnel file Caldwell had reviewed described 6 years of her life as contract logistics work overseas. She said that was the cover language, and that it was accurate in the way that cover language is designed to be accurate, technically defensible, operationally meaningless. She said she had not planned to explain what was underneath it, and that she was explaining it now not because she needed this job, but because the man whose life she had fought for in OR4 deserved to have the record reflect what actually happened in that room. For 6 years, she had served as the senior medical specialist attached to a Special Operations Aviation Unit, the 160th Special Operations Aviation Regiment, the force that ran missions in conditions and locations that did not appear in any publicly accessible operational record. She flew on MH-60 Blackhawks into active combat zones at night. She treated casualties in the field in the aircraft in forward positions, where the nearest surgical capability was hours away, and the margin between a soldier making it and not making it was entirely dependent on what she could do with what she had in the time available. She had performed procedures in those conditions that she would not have been credentialed to perform in a civilian hospital, because the credentialing systems of civilian medicine were not designed for the circumstances she was operating in. And because when a man is bleeding out in a helicopter at low altitude over hostile territory, the relevant question is not whether the person treating him has the right license. The relevant question is whether she knows what she is doing. 3 years ago, she said this without changing her tone, without the kind of dramatic preparation that people use when they want the room to understand that what comes next is significant. 3 years ago, her unit's helicopter went down during a mission in Syria. The details of the mission itself were still classified and would remain so, and she was not going to provide them. What she could say was that the aircraft went down hard, that the lead surgeon on her team was killed on impact, and that she was the senior medical person standing when the dust settled. There were wounded. There was no incoming extraction for 3 hours. The firefight that had contributed to the crash was still ongoing less than 70 meters from the wreckage when she started working. In those 3 hours, she placed 2 chest tubes and performed an emergency surgical airway on a soldier whose trachea had been compromised in the impact. She performed a blind aortic occlusion, the same procedure she had performed 8 hours ago on Marcus Webb, on a special operations soldier whose pelvic and abdominal injuries were severe enough that he would not have survived to see the rescue aircraft without it. She kept him alive for 3 hours on manual intervention and field supplies, in the dark under fire, without imaging, without a surgical team, without anything except the training that her unit had given her and the understanding that if she stopped, he died. The Army gave her the Silver Star for what she did that night. The citation was classified. The medal itself was in a lockbox in her apartment. She had not told anyone about it since she left the service because the life she was trying to build here was supposed to be quiet, and quiet required that certain things stay in certain boxes. She looked at Caldwell when she was done. She told him that she understood the hospital had a position, and that the position had legal logic behind it, and that she was not dismissing the institutional reality he was managing. But she asked him to consider in that same institutional frame what the liability picture looked like. If Harborview Medical Center terminated and reported to the nursing commission the woman who had just prevented a man from dying in their trauma bay, and if that story, with all of its details, became the version that the public encountered, rather than the version that Langdon had been constructing since 8 o'clock this morning. The room was very quiet. Hollister spoke before Caldwell could. He turned to face Langdon directly, which he had not done until now, and what he said was not an accusation. It was a description delivered in the same flat, measured tone he had used for everything else. He said that the security footage from the trauma bay showed a resident attempting to physically take a piece of equipment from a nurse who was in the process of using it, losing his footing when he lunged and falling. It showed another nurse stepping between them. It showed Ariana Nelson returning to the patient without further engagement. If Langdon wanted to characterize any of that as a physical attack he had suffered, Hollister said he was welcome to request the footage himself and present it to whoever he chose. Langdon said nothing. He was looking at a point on the wall somewhere above Caldwell's head, and his jaw was doing something complicated that did not resolve into words. Hollister laid out what he believed the appropriate response to the previous night's events looked like. He said it without asking anyone's permission, because he had decided on his way up in the elevator that he was the senior physician in this building, and that he was done waiting for administrative processes to catch up with clinical reality. Langdon would take 6 weeks of administrative leave during which his performance in the trauma bay would be formally evaluated before he returned to any supervisory role. The disciplinary file against Ariana would be closed and removed. She would take the remainder of the weekend, and she would report on Monday morning to the trauma surgery department, where she would be working directly under Hollister's supervision in a capacity that reflected her actual capabilities. Caldwell looked at the paper on the table and at the resignation document and at the closed face of the man across from him who had run trauma surgery at this hospital for 19 years and whose departure would cost them their Level 1 designation. He picked up the resignation document, aligned its edges, and placed it face down on his side of the table. He said that he would need to consult with legal before formalizing any of the personnel arrangements Hollister had described, but that he saw no reason to proceed with the termination while that consultation was ongoing. He said it in the careful language of a man retreating to a position he could defend, and everyone in the room understood what it meant. Langdon left without speaking. He walked to the door and opened it and went through it, and the sound of it closing behind him was the quietest thing that had happened in the room all morning. Ariana stood up and straightened the front of her scrub top, the same motion she made at the end of every shift, automatic, unremarkable. She did not look at the place where Langdon had been standing. She did not say anything to Caldwell, who was already organizing the papers in front of him with the focused attention of a man who wanted to project that he had other things to manage. She looked at Hollister, and what passed between them was not gratitude and was not relief. It was the recognition of two people who had each, at some point in their lives, been in rooms considerably more dangerous than this one, and had come out the other side, and who understood without discussing it that the metric for a good outcome was not how you felt afterward, but whether everyone who should have made it through the door actually did. She gave him a single nod. He returned it. She walked out of the conference room and into the corridor where the hospital was already fully into the business of its day transport staff, with gurneys, a group of residents moving toward the elevator, with coffees. A family standing near the waiting room door, with the particular stillness of people who have been there long enough to stop watching the hallway. Nobody looked at her twice. She was a nurse in scrubs at the end of a long shift, moving toward the exit, indistinguishable from every other person in the building who had spent the night keeping someone alive. Somewhere on the 6th floor, Marcus Webb was in the ICU with 2 surgical drains and a blood pressure that was trending in the right direction. He did not know who had found his femoral artery in the dark. He did not know about the 3 words whispered in a trauma bay at midnight, or the conference room at 8:15, or the 6 years of classified work that had made all of it possible. He did not know any of it, and that was exactly as it should be. Hollister stood at the window at the end of the corridor and watched Ariana walk down the hall until the morning crowd absorbed her and she was gone. I was the only person in the building who knew the full answer to the question he had asked her, and he understood that this was a thing she had given him carefully under specific pressure as a last resort, not a gift, not a confession, but a tool deployed when the situation required it, and not a moment before. She would be back on Monday. She would be quiet and precise and unremarkable, and she would stand in the right place at the right time and read the room the way she always read it, door equipment position of every person present, and when the next patient came in who had run out of time, she would already be moving. That was all she had ever wanted to do. The 3 words she had whispered 8 hours ago had never really been about her. They had been about the man on the table who needed someone in that room to know what they were doing. The rest of it, the history, the metal, the years of darkness and noise and controlled chaos at altitude, that was just the explanation for why she did. She pushed through this exit door and stepped out into the gray Seattle morning, and the city closed around her and she disappeared into it, the way people do when they have learned that the most useful thing you can be in almost any situation is the one nobody sees coming. Some people carry their whole story in silence, and you'd never know what they were capable of until the moment it mattered most. If Ariana's story stayed with you, subscribe to the channel. Every week we bring you another person hiding something extraordinary behind an ordinary life. The next one might surprise you even more.